Lennox-Gastaut syndrome, LGS, finding the right dose and managing side effects. Before you continue, here is some select important safety information. Before prescribing FINTEPLA, your healthcare provider will discuss the potential benefits and risks, including possible side effects. For a loved one with Lennox-Gastaut syndrome, or LGS, finding the right dose is key. Remember, everyone is unique, and the treatment goal is to find the dose that helps reduce seizures while managing potential side effects. Finding the right dose is an important first step. Patients with LGS and starting treatment with FINTEPLA should start at the 0.2 milligrams per kilogram per day dose and increase the dose weekly based on tolerability to the maximum recommended maintenance dose of 0.7 milligrams per kilogram per day, with a maximum total daily dose of 26 milligrams. In the clinical study, 0.7 milligrams per kilogram per day was the only dose of FINTEPLA to significantly reduce monthly drop seizures. Your loved one's current anti-seizure treatment plan may not need to be adjusted when adding FINTEPLA. You can add FINTEPLA to the current anti-seizure treatment plan without delay or potential disruption. However, you may need to adjust the maximum daily dose of FINTEPLA if your loved one is also taking certain other therapeutic medicines or has certain other medical conditions. If symptoms or side effects occur, your healthcare provider may adjust the medicine until the best dose is reached. It's important to tell your healthcare provider about all of your loved one's medical conditions and the medicines they take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, and always give the medication as prescribed. Now let's talk about side effects. The most common side effects of FINTEPLA when used to treat LGS included diarrhea, decreased appetite, tiredness, sleepiness, and vomiting. In the clinical study, only about 6% of patients discontinued treatment due to side effects. The most common side effects leading to discontinuation in patients with LGS were seizures, 2%, and sleepiness, 2%. These are not all the possible side effects of FINTEPLA. For more information, ask your healthcare provider. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. And don't stop giving FINTEPLA without first talking with your healthcare provider. It could suddenly cause more frequent seizures or seizures that do not stop. You know your loved one better than anyone. With your input and the expertise of your healthcare provider, your loved one can experience FINTEPLA at its best. If you have questions about FINTEPLA, you can call 1-833-GO-DS-LGS or 1-833-463-7547 to speak with a live clinical nurse educator who is a registered nurse highly knowledgeable about FINTEPLA, REMS, and Lennox-Gastaut syndrome. As part of the Onward Support and Services program, the clinical nurse educator can help you make informed decisions about treatment with FINTEPLA and help you prepare for a conversation with your loved one's healthcare provider.
Indication: FINTEPLA is a prescription medicine used to treat seizures associated with Dravet syndrome and Lennox-Gastaut syndrome in patients 2 years of age and older. It is not known if FINTEPLA is safe and effective in children less than 2 years of age. Important safety information: FINTEPLA can cause serious side effects, including 1. Problems with the valves in the heart, valvular heart disease, and high blood pressure in the arteries of the lungs, pulmonary arterial hypertension, have been associated with FINTEPLA. Your healthcare provider will do a test called an echocardiogram to check your heart and to evaluate for high blood pressure in the arteries of the lungs before you start taking FINTEPLA. Again, every 6 months during treatment, and one time 3 to 6 months after you take your last dose of FINTEPLA. Call your healthcare provider right away if you develop any of these signs and symptoms of heart or lung problems during treatment with FINTEPLA. Shortness of breath, tiredness or weakness, especially with increased activity, lightheadedness or fainting, swollen ankles or feet, chest pain, sensations of a rapid, fluttering heartbeat, palpitations, irregular pulse, bluish color of your lips and skin, cyanosis. Because of the risk of heart valve problems, valvular heart disease, and high blood pressure in the arteries of the lungs, pulmonary arterial hypertension, FINTEPLA is only available through a restricted program called the FINTEPLA Risk Evaluation and Mitigation Strategy, REMS. Before you or your child receives FINTEPLA, your healthcare provider or pharmacist will make sure you understand how to take FINTEPLA safely. If you have any questions about FINTEPLA, ask your healthcare provider. Visit www.finteplarems.com or call 1-877-964-3649. 2. Decreased appetite and decreased weight. Decreased appetite and decreased weight are serious and common side effects of FINTEPLA. Your weight should be checked regularly during your treatment with FINTEPLA. Your healthcare provider may need to make changes to your FINTEPLA dose if your weight decreases. In some cases, FINTEPLA may need to be stopped. 3. Sleepiness, sedation, and lack of energy, lethargy. These are serious and common side effects of FINTEPLA. Taking FINTEPLA with central nervous system, CNS depressants, including alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how FINTEPLA affects you. 4. Like all other anti-epileptic drugs, FINTEPLA may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your healthcare provider right away if you have any of these symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying, trouble sleeping, insomnia, attempts to commit suicide, new or worse irritability, new or worse depression, acting aggressive, being angry or violent, new or worse anxiety, acting on dangerous impulses, feeling agitated or restless, an extreme increase in activity and talking, mania, panic attacks, other unusual changes in behavior or mood. How can I watch for early symptoms of suicidal thoughts and actions? Pay attention to any changes, especially sudden changes, in mood, behaviors, thoughts, or feelings. Keep all follow-up visits with your healthcare provider as scheduled. Suicidal thoughts or actions can be caused by things other than medicines. If you have suicidal thoughts or actions, your healthcare provider may check for other causes. 5. Do not stop taking FINTEPLA without first talking to your healthcare provider. Stopping a seizure medicine such as FINTEPLA can suddenly cause you to have seizures more often or seizures that do not stop, status epilepticus. Do not take FINTEPLA if you are allergic to fenfluramine or any of the ingredients in FINTEPLA. See the medication guide for a complete list of ingredients in FINTEPLA. Are taking or have stopped taking medicines called monoamine oxidase inhibitors, MAOIs, in the last 14 days. This may cause a serious or life-threatening problem called serotonin syndrome. If you are not sure whether or not you are taking one of these medicines, contact your healthcare provider. Before taking FINTEPLA, tell your healthcare provider about all your medical conditions, including heart problems, weight loss, depression, mood problems, or suicidal thoughts or behavior, kidney problems, liver problems, are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of FINTEPLA? FINTEPLA may cause serious side effects, including see FINTEPLA can cause serious side effects above. Serotonin syndrome. Serotonin syndrome is a life-threatening problem that can happen in people taking FINTEPLA. especially if FINTEPLA is taken with certain other medicines, including antidepressant medicines called SSRIs, SNRIs, TCAs, and MAOIs, tryptophan, lithium, antipsychotics, St. John's wort, dextromethorphan, tramadol. Call your healthcare provider right away if you have any of the following symptoms of serotonin syndrome: mental status changes such as seeing things that are not there, hallucinations, agitation or coma, changes in blood pressure, tight muscles, fast heartbeat, nausea, vomiting or diarrhea, high body temperature, trouble walking. High blood pressure, hypertension. Hypertension is a serious and common side effect. FINTEPLA can cause your blood pressure to increase, even if you have never had high blood pressure before. Increased pressure in your eyes, glaucoma. Symptoms of glaucoma may include red eyes, seeing halos or bright colors around lights, nausea or vomiting, decreased vision, eye pain or discomfort, blurred vision. If you have any of these symptoms, call your healthcare provider right away. The most common side effects of FINTEPLA when used to treat patients with Dravet syndrome, DS, include decreased appetite, diarrhea, low energy, respiratory infection, decreased weight, fever, constipation, abnormal echocardiogram, sleepiness, problems with movement, balance, and walking, increased drooling, increased blood pressure, vomiting, falls, seizures that do not stop, weakness. The most common side effects of FINTEPLA when used to treat patients with Lennox-Gastaut syndrome, LGS, include diarrhea, tiredness, vomiting, sleepiness, decreased appetite. These are not all the possible side effects of FINTEPLA. For more information, ask your healthcare provider or pharmacist. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Keep FINTEPLA and all medicines out of the reach of children. Please see full prescribing information, including medication guide, for additional important safety information on FINTEPLA.